Vietnam. Okay, these are the picture of my clinic, of our system. Okay, we will start the subject today. My subject I want to show you today is the power of 3D simulation in diagnostic and orthodontic treatment. First, I know the famous sentence of Dr. Ronan wrote, "We spend too much time for treating and not enough time for diagnostic." So my presentation today is we will introduce about how to reduce the time and how to have the best diagnostic for our orthodontic treatment plan. First, we talk about the making a treatment plan. For making a treatment plan, it did not change so much from the beginning. The first part, we have to collect the records on the record of the patient. First, intra-extraoral picture. We can do it easily with a lot of software. We can do it also with Webceph. Collect the X-ray, panoramic, cephalometric, collect study model. Then we're making a treatment plan. Okay. After the classic way for making a treatment plan, we have to do the soft tissue, smile, face analysis. Then do cephalometric analysis. This one we do with Webceph. And after study model analysis for measure the bone tone discrepancy or measure the